using our PDL laser today. This is a laser that will help treat blood vessel proliferation, broken blood vessels, little pink, purple, red spots. It also has a slightly deeper wavelength that will try to get pigment and color that's a little bit further down in the skin.
Great, great. We're at the office of Fincher Chips in Beverly Hills, California, and today is Wednesday, April the 4th, 2018. I'm Howard Paul Short, and with me I have Dr. Jennifer Herman.
Yep.
So how long have you been doing this procedure for?
I've been at this practice for 2.5 years. I got my MD in 2009, so I've been doing it for a long time now.
Oh, great. Do you think it's possible we could show people, what I'm going to get done?
Yeah, we can. It's a very small spot, so it's a little bit hard to see. This laser is quite good for anything that's red or purple in the skin.
Let me show them the redness here. No worries.
This is a challenge. This is kind of a darker purple. It's from a prior scar. We're going to see if we can get down deeper in the skin to break up some of that pigmentation and a little bit of that purple color. The laser is very smart. It targets hemoglobin, which is in the red blood cell, and it heats that up, and then that collaterally damages the blood vessel walls on either side and kind of causes them to shrink down. So we look for a slight color change when we use the laser. Usually things get a little bit more purple, and sometimes lighter blood vessels just disappear instantly. So we'll kind of play around with some settings and see if we can get both of these spots improved for you.
That's great. And then question, after I get the procedure done, what kind of aftercare should I apply to both of the areas?
This is an easy laser. We don't have to do a lot of aftercare. You shouldn't have any really crusting or change of the surface of the skin. You may have a little bit more of a bruise type of look temporarily, and then that kind of fades out. So you don't need to use any special ointments or lotions. Sunscreen always is good on your face, especially if you're in a bathing suit. Sunscreen on this area is perfect, but you don't need to be specific aftercare. It's pretty easy.
Oh, perfect. Well, I'm ready to go.
All right, let's get you up here.
Thank you.
So for that here, we will use some eye protection.
Okay.
So make sure that we don't want anything to happen in the eyes. We have a couple more.
Oh, thank you. Perfect.
Gonna put these over.
You may be able to see these little guys on his nose, some of those little blood vessels. We should be able to see if you can focus that in there.
I'll keep my eyes shut.
Yeah, it's good just to close your eyes. The laser feels like a little rubber band snap. So we'll start with kind of a light setting and just see where we're at. I'm going to have you turn your head this way, just so we can get to this cheek.
Do I need any numbing cream at all?
Nope. The cool air that this laser uses, it should just, it helps cool the skin. It will feel more comfortable, and it actually protects the skin as well. We're going to calibrate the laser. On this little spot over here first. So you're going to do 1, 2, 3. How'd that feel?
It's okay.
Not too much?
No, I'm fine. It's like a little shock.
Yeah, it's a little rubber band snap. I'm going to come back and do a slightly different setting for that. Kim, you can see these little blood vessels around his nose. I don't know if you can see that.
Mm-hmm.
So we're going to see if we can hit those little guys out. So just, here we go, 1, 2, 3. They're turning kind of purplish and almost disappearing. You can see they're a little dusky purple right now. How you doing, okay? I know this air is kind of takes your breath away a little bit.
I'm good, thank you.
All right.
I trust you.
So that's definitely, if you look at the blood vessels now, they're pretty much disappeared. So that's just what we want for that reaction. Let me have you turn back this way. I'm going to try to do these guys on this side for you. They're really, this area, the blood vessels tend to be quite stubborn because there's a giant artery that runs right beneath them that feeds them. But this should absolutely help them disappear for you. It's nice to have a little bit more even skin tone with those guys lessened.
Yeah, I have a quick question.
Yep.
Around the chin area, you see there's a little bit of like pits, I guess.
Yeah.
Would that help at all for that? I don't even know.
This laser wouldn't. That's more from acne scarring.
I
That's
see.
where we need to use one of our ablative resurfacing lasers.
Got
to
you.
kind of stimulate collagen synthesis a little bit more.
Got
I'm
you.
going to change the setting to do this duplex that we use on this laser. This is where the laser wavelength will go a little bit deeper to try to capture any kind of color that's deeper down. Try one more of this little guy. Let me have you turn your head all the way this way. And this one is stubborn. We'll see. If we don't get it, you know, like I said, there's other ways to treat it. That second pulse is definitely improving it. So let's see what that does. We have to give it a couple weeks to see. It's definitely lighter, and we'll just see if it influences. Now let's take a look at that scar that's on. Which hip is it on?
It's over here.
This one?
Yeah.
Okay. See if we can get that down.
How's that?
That's perfect. So
No
we're going to
worries.
just
Take your
try on
time.
this one. You okay?
I'm fine, thank you. Tell me again the name of this laser machine.
It has two wavelengths in it. There's a 1064, that's the longer one, and then there's a classic PDL. So it's got both, and you know, part of the idea of using, again, the combination is that second wavelength, that 1064, fires right after the PDL and can, as hemoglobin changes in conformation after it's hit with the first laser, the idea is that the second pulse will get even more of it to help improve the clearing faster, and it also reaches down deeper. So we'll see. We'll see if that makes a dent at all on it. So there's also some pigment to that scar, and that's, you know, that's a little harder to treat with this laser. Sometimes we use that tattoo removal laser to try to get some of the brown that's
That
in
could
there.
help too, yeah.
It's possible. We'll see if this does leave it for you, and if we need to hit it with the other one, we can do that.
I noticed, you know, on here, maybe I'm wrong, but it looks like there's some white little patches.
There's a little bit of white because that's, you know, it's clearly, you know, there was a lot of injury in there, and when that injury happens, it changes, it messes up the pigment cells, so they drop the pigment down deeper in the skin, and then it just kind of stays there. Your body doesn't clear it perfectly, and it can take a long time for it to fade, and sometimes just, you know, kind of hangs out there completely. But we'll see how you do with those. Well, you know, in a couple of weeks, if you still have this spot to pop in, it will try this one for you.
Great. Well, thank you very much. And once again, we're at the Fincher Dermatology Clinic in Beverly Hills, California, at 421 North Rodeo Drive, Beverly Hills, California. I'm Howard Paul Shore with Dr. Herman. Thank you very much. And if you need great dermatology work, you got the right
We're here
place.
for you.
Thank you. Have a great day.